All right, welcome back. Really big topic right now. The Trump administration says it is looking at a new treatment for autism spectrum disorder, a prescription form of vitamin B9 called Leucovorin. The FDA recently announced that it would change the drug's label to reflect potential benefits in reducing autism symptoms. But many scientists and medical organizations, they still say that they're skeptical about its use for this community. Dr. Brobson Lutz joining us this morning to explain all the sides of Leucovorin's use in autistic children. Thanks so much for being here on a really important topic, Doc. Yeah, so explain to people what Leucovorin is. Let's start there.
Leucovorin has been around for decades. It was a medication that I first prescribed as a resident at Charity Hospital with people undergoing certain types of chemotherapy that would block the uptake of folate. And folinic acid, or Leucovorin, takes the place of folate in the bone marrow, and it's an essential vitamin, so to speak, that's necessary for normal functioning.
And at what point did they realize, they being the medical community, discovered that this drug that you use for chemo patients could be applied to children with autism?
Actually, several years ago, maybe 10, 15 years ago, it was suggested and some people started using it. I think it's important to note that while it does have side effects, the side effects are not all that great, and there are not that many. Sometimes a little increased agitation, maybe some tummy problems and all. But when you have a medication that's been around for decades and is relatively safe, I certainly think it's worth a try if there's some noise out there saying it works. And there are some studies, but they're limited studies. Like one study looked at 40 children who took, with autism, who took the drug, and then 40 children who didn't, and there were improvement was noted in a certain percent of the people that took it, but no study needs to be believed more or less by itself. Okay. So there's room for more work there, but I think it is important that the FDA did recognize this and added it as a possible indication.
So if you are a parent out there who has a child with autism, what are the tests that you need to request of your pediatrician to see if your child could be responsive to this medication to make autism a little less interfering with their social lives? I've read a few studies that show it can make children that are nonverbal more likely or easier to become verbal. Talk about which tests are out there.
That's right, and it's thought to work through an antibody type system where the children with autism have this antibody that blocks folate uptake into the cell, and if they take Leucovorin, that substitutes for it. Now, I don't know how widely that test is available. It's probably just easier to give it a try. But you need to be dealing with a pediatrician or a pediatric neurologist who knows about this, who has used it, to make sure you get the proper dosing and the proper follow-up, which is all very important. And actually, not all of that's been worked out yet.
Okay.
But this is sort of promising, because while I don't believe the incidence of autism has increased over the generations, the recognition of it certainly has.
Sure. Dr. Brobson Lutz on a really important topic. Thanks for
Thank you.